in my office is always the opposite of whatever is going on outside. So I'm getting cold in here, so I'm hoping that it's getting warm outside. So we will see. Today I'm going to be talking about overcoming the pandemic in early childhood. So I wanted to present on something different, and when Mitra had put out about what we would be presenting on in this part of the didactic, I started reading a lot of journal articles. Well, I was getting a lot of journal articles about the impact of the pandemic in early childhood. And I'm sure you all have been coming across these articles as more and more are getting published because we're getting more and more data of the impact of the pandemic. And so as I was reading things, I was like, oh, this is good stuff. Like, I definitely want to share it. So that's what brings me to presenting Overcoming the Pandemic in Early Childhood today. So we will start off with the pandemic that we had dealt with in 2020 was COVID-19, right? This kind of hit us all like a tidal wave. It kind of took us off kilter. We gained our ground. We were feeling pretty good with it. And then it hit us again. And then it felt it hit us again, and just in different ways. And so this pandemic just continued to hit us over and over again. But COVID-19 was the very contagious infectious disease, or is, caused by the SARS-CoV-2, and many of us experience this. Very rare now that you find anybody that has not had COVID. Even this with all the different variants, this last variant, it seems like everyone's like, I went through the whole pandemic without COVID and now I got it. So I feel like everybody has had it by this time. But many of us had experienced mild to moderate symptoms and experiences with the illness. But for many people who have had underlying issues, such as any type of like heart disease, lung disease, any respiratory pieces, had become pretty seriously ill. Other underlying issues like diabetes, asthma, things like that had unfortunately led to death for many. Much of the older population had passed away once receiving COVID or containing or getting COVID. We lost my stepmother in 2020 when she was diagnosed with COVID. She had chronic lung disease, and so she had underlying issues, but how it happened was very traumatic, right? Like, and many people experienced this. She went to the hospital, she was admitted, and we didn't see her again until she had passed. And unfortunately, my dad had COVID at the same time. And so that was really hard for us all, but especially him. That was the last time he saw her, and then her coming out. So it not only impacted her and him, but the entire family. And so that's what we're really seeing, is that a lot of this had impacted not only individuals, but the entire family. And when we work with children, especially kids 5 and under in early childhood, we're not working with just that individual. We're working with entire family systems. And so that entire family system has such an impact on children. And so this really had such an impact in many different areas, and as I'm sure you all have come across. And naturally, just the definition of pandemic I have here, a widespread occurrence of infectious disease over the whole country or world. And so we experienced this tidal wave over the whole world. So everybody was experiencing this. So what we saw with children were changes in habits, right? Especially, again, we're talking about early childhood, so 5 and under. Children need warm connections, right? They're wired for that interaction and for those warm interactions. And they use those interactions to kind of base their proximity seeking. So they use these warm interactions to determine if they can regulate themselves by getting close to somebody, or if they regulate themselves by separating from somebody. And so, they weren't, depending on where they were at in their development, some of these warm interactions were not very warm initially. And when they were in public, they were not warm. I think of going to the grocery store, and I know some people hate this, but I totally did not mind this. But when you go to the grocery store, older people just like gravitate towards kids, and they always want to touch them and feel them and pinch their cheeks. And But the pandemic had changed that for a lot of people. Nobody was touching anybody. And if you think about what a shift and change that is for society, it's huge for kids, right? I think everybody was experiencing, and as I was reading a lot of this really came across to me too, like we all experience this new as adults, but a lot of the times when you start reading some of these articles, I started seeing things through like kids' eyes. I was like, wow, like their whole world's changed, right? Their whole entire world has changed. So it left a lot of disruption, a disruption in their development. They see safety and security and a lot of predictability and routines. And that predictability and those routines were kind of vanished. We didn't know what that was going to look like. So we really couldn't prepare kids. So their day-to-day changed at times. And then when it did become a little consistent, like I said, we got hit with that tidal wave again, and then it changed again. And so there were a lot of changes that continued to happen. There were family disruptions. Families had to separate. Families had to come together. And so there were a lot of different family disruptions. There was increased stresses within the family system, right? And so we'll talk about all of those. So we saw all of that. There were disruption in social skills. You know, the first 3 years for kids are all about their social emergence. And depending on where they were in that development, those social skills can diminish significantly. We're seeing social disruptions even in early children or older children. So we're seeing it across the board. Technology changed significantly, right? There was an increase of screen time, screen usage, the need for it. Everything became virtual, and so technology changed for everybody. Again, that sense of safety and security was kind of taken away. And then once COVID started being looked at and some vaccines started being developed, there was a lot of vaccine hesitation too. And so, you know, there were a lot of standards that were kind of getting looked at and being pushed and passed through. And so there was a lot of hesitation and trust of government on families' parts. And so there was a lot going on within that family system and some of that hesitation. One of the studies I looked at was a Canadian study that found that, and this is kind of scary too, that they saw definitely reported an increase in snacking with kids and screen time. So snacking and screen time and their activity has decreased. So if you think about that, that's like the perfect storm for obesity, right? And so we talk about snacking and screen time and usually not doing that at the same time for children, but a lot of kids were experiencing both at the same time and a decrease in their activity. And so that's kind of a perfect storm for moving towards obesity and bad habits within eating and their healthy lifestyle. So we know that that's a huge disruption. Another study that I came across, the National Institute for Early Childhood Research found that a lot of problems such as social emotional problems, conduct disorders, peer problems, and prosocial behaviors increased 10% more than the normal rate, right? And so we're seeing a lot of kids who are struggling with social emotional problems. So their ability to interact and socialize with one another, which is not, again, depending on where their development was, is not uncommon for kids, especially 3 and under, to have experienced, right? And so really not being able to progress with some of that. Conduct problems. We know when kids are feeling safe or not secure that they resort to old behaviors. And if those old behaviors had gotten their needs met before, they're going to kind of resort back to those. Sometimes those old behaviors are really disruptive behaviors. And so it could lead to some conduct problems. Peer problems, socializing, right? That was we were completely isolated for so long. I know I talked about on here at one point, pandemic pods and how people had started creating pandemic pods as socialization pieces. And that was actually really helpful for a lot of families as far as helping with their support and also socializing for their children. Pandemic pods were families that had chosen to follow the CDC guidelines, not really expose themselves or their family members, and only choose to expose themselves to like 2 other families, right? So like 2 or 3 families in a pandemic pod. So then they would get together knowing that they are following some of the same guidelines. So A lot of those had occurred. I had 2 or 3 families that did pandemic pods, and they really kept some great relationships throughout. And one of those families I continue to work with, as their child has some extreme anxiety and fears around getting sick now. And so we're working on that now, but the pandemic pod was something that was really beneficial for them. We saw a lot of behavior changes. I know initially with the pandemic, and like the first 3 tidal waves that we had, like the first 3 episodes of COVID and big outbreaks, you know, we saw a lot of behavior changes. I had a lot of parents reaching out to me because they were managing difficult behaviors for a lot of different reasons. But the overall stress has caused a lot of behavior changes within the home. And we have to remember, that within early development, we have that experience expectancy, right? And so kids have this experience expectancy, and experience expectancy is when our brain knows something's going to happen. So they're so used to kind of like routine and the same thing over and over again that their brain just expects this to happen, right? So it's kind of like if we did the eating, like if kids eat in front of the TV, once the TV goes on, a lot of the times that's why they kind of snack a little bit more, because their brain kind of expects that, like, oh, the TV's on, so I'm going to snack, which is a really unhealthy way to snack. And so that's why a lot of people kind of overeat in those situations. The same thing if you, as an adult, if you get a new job, right? You drive to like your old job for a couple times. And that's your experience expectancy, right? Your brain kind of knows, oh, we're getting in the car, it's early in the morning, we're going to this destination. And so for kids, their whole life is based off of some of these patterns of interaction, because they don't get that cognitive perception. And so when they memorize these patterns of interaction, or they have these experience expectancies, many of the times when it's taken away, we see behaviors. So we see this in kids who have a difficult time transitioning, right? If they are going out the door before they got to get their special drink and they're going off to school, then you have a kid that's kind of having a meltdown, like, I didn't get my drink. And parents who are rushing and they're like, oh, well, we just have to go, right? That's experience expectancy. They're used to getting this drink. And so we can avoid some of those behaviors by doing some of the same things over and over again with routines. We see a lot of the times, I have one family in particular that had really poor routine habits, right? And their kids became a little more experience dependent. And so experience dependent is depending on the environment to determine what comes next, right? So they didn't have that experience expectancy to begin with, so they didn't have that level of stress. Now, one of the children in that family already has high anxiety, and so naturally any type of stress can just heighten some of those situations. But they're more experience dependent, so they're dependent on kind of their environment. So we saw a lot of these behavior changes. A lot of things changed in children's worlds, right? Their social interaction, their friends, that's a loss. They've lost their interactions with their friends. Screen usage had increased. We were using screens for everything: homework, downtime, time while parents were trying to work, doctor's appointments. So everything was on screens. And so there was definitely an increase in screen usage. One of the things that was discussed and talked about that I hadn't really taken into consideration is space limitation. Again, thinking from a kid's point of view and perspective, right? Their home is like their domain. They get to, you have little kids, especially toddlers, they rule the roost, right? They're running all over the place. They invade the bathroom, they invade your bedroom. Really, nothing is off limits. But when it came to the pandemic, a lot of things were off limits. Parents' bedrooms or office space were off limits to children, right? Because they had to work or get things done. When somebody was sick, they had to isolate, and so they were off limits. So where kids used to be able to have access to things like that, they didn't. When they were sick, they had to isolate. They were used to parents cuddling them and being with them. And I mean, I don't know about everyone else, but I totally still cuddled my kids when they were sick. But was still safe about it, right? Still wore a mask and still safe in those situations. So there were a lot of space limitations. Again, we talked about physical activity decreasing naturally. Playtime changed, playtime became singular, or if you had siblings, then with the siblings, but that was increased sibling time then too, or with adults, right? And eating habits as well. So again, social skills changed significantly. Those first 3 years, social emergence, all about building that. So if you think about it, if there was like a 1-year-old that was going into the pandemic, this was like the height of their social emergence, right? Like they just started building some of that joint attention and interactive play, still parallel play, but starting to want to play with others, trying to share and take turns, right? And now the 2-year-old that's really trying to pretend and explore their world, they really don't have that capability to do that because, for one, for some children, their sense of safety and security was taken away. Many children were lucky and their parents kind of developed this new sense of safety and security, where they didn't allow children to kind of feel that stress, which was kind of hard because there was a lot of stress on all of us. And so they were still able to emerge some, but especially for 3-year-olds, right? So 2-year-old going into the pandemic and turning 3, that was really hard because now you're seeking that, you're wanting those relationships, you're wanting to build with friends, you're wanting to have interactive play, you're wanting to grow and develop with other friends and play house and play kitchen, and you don't have that, or if you do have that, it's limited, right? And so this could reduce a lot of social skills come later on. And these social skills are really helpful. I mean, this is a lot that's done in preschool, and these social skills help with academic preparation. And so now we're looking at some of that academic preparation really being taken away with COVID. And so we're seeing some kids really struggle. Now, when you look back on that problem list, right, naturally they're struggling with pro-social behaviors and social emotional development. It makes sense, right? Because at 3 years old, this is when they're starting that interactive play. I think this is probably one of my biggest pet peeves when I have patients that come to me and they say, my kid's getting kicked out of kindergarten because they're 2-year-old and they're not really sharing well and they're not playing with others. They're not doing interactive play. And I'm like, well, they're developmentally appropriate, right? Like that doesn't come till 3. But now we're seeing even at 3, he's still struggling with that and having a difficult time. So we're definitely seeing some delays with that. Family disruptions, we saw all kind of family disruptions, right? And for many kids, this is where we saw behaviors, right? And this is where we tried to organize and do a lot of parent management techniques and working with parents on managing their stress, evaluating their stress and their stress levels and how that's displayed and where they can limit that, right? And even I think of the sessions we did during the pandemic, right? Space limitation. They had to get their kids to sit in another space so that they could talk about these stressors so that they could reduce them to provide them more of a routine and safe and secure environment. And many of the times that involves screen time, right? And so you think about that. So permanent parents, they were permanent parents. A lot of parents struggled with job losses. And so losing their financial stability, having fears around that, fears around the pandemic, fears around what was going to happen, fears around their children's development, fears around school and their education. And so there were so many fears that were going on. And these were daily stressors for families and individuals. Food had become a stress, accessibility to food, accessibility to items, going grocery shopping, right? That became a stress, having to know what aisle to go up and what aisle to come down. That was a stress for me. So many of these stresses just spilled over. And so we had a lot of stress overspill, separation of families. So we had strained relationships, right? And losses. I mean, this is a loss. The reality is we live in a state where the primary caregiver many of the times is a grandparent, and grandparents were being urged to not have as much interaction as older individuals and more at-risk individuals not having interactions with children, right? We see a lot of separation there. There was a lot of screen time. We did a lot of work around making screen time quality time, especially in early childhood, and how to do that. So we had sessions around that. But that's a huge loss, and that's a strain within those relationships and those family relationships. And holidays had to be gone alone and only with one another, and not really celebrating as whole families. So that's a huge loss. That's a disruption in that family system. It's a huge impact on children. Increased sibling time. There was a whole paragraph on increased sibling time, and I totally did not think about this part, but I'm thinking the increased sibling time really created some disruptive relationships between siblings. And naturally siblings fight, but for many siblings that did not have a supportive environment that could kind of help them with some of that cohesiveness, it really created a strain between a lot of siblings. And so it's hard to have to play with your sibling all the time. And if you think about it, kids go to school there in separate classrooms, and even with twins, they try to separate them into different classrooms. And so you get that time and interaction with other kids, and then you're stuck with your sibling all day, every day. Yeah, so that had to be a strain on a lot of families. Managing school schedules and getting children to complete their homework, do their homework, sit there. And for many in early childhood, that was a challenge. That was a huge challenge in itself. And I have to give credit to so many teachers and preschool workers and a lot of social skills groups that worked with younger children, like becoming creative and finding what works and using puppets and using toys and using their environment and really using whatever was around them to help really include and be inclusive with children. Was really creative, and I think a lot of people really just kind of took that on and became creative. They had to, right? They had no choice, so they kind of did that. It was more of a stress crossover, right? And so we have the stress spillover, which is like the stress that's spilled over and impacted the entire family system. And then the stress crossover is more of the adaptation. So it was stressful and it was difficult, but many families adapted. They figured out what functioned, what worked. And so they experienced the stress and this disruption, and then they figured it out. Some did not. Some experienced a lot of stress throughout the entire time. And then, of course, losses were huge. Loss of school, loss of daily activity, loss of peer interactions, loss of family. And loss of just their normal everyday life, right? And so kids experience a lot of losses, and naturally this came out in behaviors. But what we saw happening over time was that behavior shifted from outward. So we started seeing a lot of behavioral pieces, and now we're seeing more inward. So now that things have gone back to kind of what a new normal looks like, and you'll see that a lot of kids are really struggling emotionally. And so we see a lot of stress and heightened anxiety, along with depression. And so we're seeing a lot of kids struggling more emotionally now, where before they were kind of outward acting, and now we're seeing that invested a little more inward. But these disruptions definitely impact child development, as many of you can guess. Physical development, naturally, like we talked about, eating habits and activity levels have changed. So physically, it's going to impact them. Kids not having physical activity impacts so many different facets of their body, right? From their bone density to their muscle mass and development. And I tell my daughter all that. So my daughter broke her knee in last May from sprinting, pivoted and sprinted, her knee dislocated, and she broke it. And I tell the doctor all the time, I told him, I said, I think it's from lack of calcium and lack of activity due to the pandemic. I'm totally blaming the pandemic and her poor eating habits. Because really there's no other reason why that would have happened. It's just kind of weird. But I told her doctor all the time, who would just kind of laugh at me. But he did say that there have been a lot more injuries in children. So I wonder if that's something being looked at. Social emotional development, like I said, we're seeing that with children who are struggling with their emotions during the day. There's more of an increase of children missing school, being excused from school. I know in my caseload personally, I have one family that I work closely with where the child is in kindergarten, and so this pandemic had a huge impact on that social emergence, such heightened anxiety. And she still struggles with a lot of her anxiety around sending her child to school. So naturally, it's not a huge fight when he wants to come home, and she actually wants to keep him home a lot of the times. And so we work a lot around both of those anxieties, how to manage it so that she's not projecting her anxiety onto him, and then how to help him with his anxiety. So teaching her some of those strategies and coping skills to manage some of his anxiety through this. And so it's a big struggle for a lot of families. So naturally it impacts their peer relationships and their ability to have pro-social behaviors. And when we have any type of delay in those areas, all of their neurological capacities go to those areas to building their brain. So then it kind of takes away from some of their cognitive development. So you can see hand in hand where some of these disruptions can absolutely cause some delays and language delays. And so there's a lot of language delays too. And I know a lot of people, especially on here, I know we've asked this a couple of times about the impact of face masks, and all of the studies that I have read and all of the literature that I have read has not contributed language delays to face masks, because it seems that children have adapted mainly to the face masks. And I've noticed that a little bit with some of the kids that I work with. They definitely are more heightened to tone and eye movement. But I mean, that's just my personal experience. I don't know that based off of any research, but I think that would be super interesting to look into. But all of the literature that I have read talked about language development being delayed because of that social interaction, right? And so a lot of kids that kind of, if you think about like kids in daycare or preschool, like they're cooing back, like sometimes it seems like they're talking to one another, right? Like they babble back and forth to one another and coo to one another. Well, that's actually a really significant piece of language development. And so when playtime changed during the pandemic, you had some parents that babbled back and forth, and we totally would, right? That kind of that serve and receive. But even think of it as a parent, right? Even the most interactive parent, you're not doing it as much as another child would be. So you're not doing, they could do it probably for hours, where we're only doing it for about 10% of that time. And so that has had a huge impact on language development. So potential post-pandemic problems. Of course, we see trauma, and a lot of people go to trauma. But for some kids who've had that stress crossover and that ability to adapt, and families that have really moved towards making the best of those situations, there's not a whole lot of trauma. And so even with some of the major losses, it all depends on it all depends on their protective factors around that. And so just because we went through a pandemic doesn't necessarily mean we're traumatized by it, or we have individuals traumatized by it. And sometimes, and I actually had an intern that questioned me at one point about an increase in child's behaviors during the pandemic. And clearly it's signs of trauma, and that they were traumatized. And we talked about like some of what we just talked about today, right? Their experience expectancy and how much that has changed, and not necessarily trauma, but that there's a huge change in their routine and their daily interactions, and that we can kind of address some of that. So naturally, mental health, we are seeing an increase in some mental health issues early on. Grief, again, loss of not only individuals, but space, time, friends, school. So a loss of so many different pieces. Face masks. So face masks can be a potential problem too. Not necessarily the hiding the mouthpiece, but a lot of fights and behaviors came around fighting with kids wearing face masks, putting them on. Some of the rules around face masks, kids pulling on other kids' face masks, right? But now we're seeing a lot of kids that still want to wear face masks. And so I have to be honest with the people who refuse to wear face masks. My kids 5 and under were the best participants in wearing the face masks. So I'm sure it's a little different in school and wearing it all day long. I only see them for an hour at a time. But and many kids would be so great and polite about it. I have quite a few that, I mean, we just got rid of our face masks here, and I don't know about you all, but I still feel a little naked not wearing a face mask when I go to grab mine before I go to the bathroom every time. But I had little ones that would say, can I take my face mask off? And a lot of my work is dyadic work. So they would say, can I take my face mask off when you leave the room? And so they knew and they adapted and they were totally appropriate. Or if their parents said, we're getting ready to go out, you got to put your face mask off, they'd come over and put their faces up. And so I did not have a whole lot that were super reluctant. Even the defiant ones, they would fight a little, but they still weren't super reluctant with it. We are seeing definite increase in social anxiety. I'm seeing a lot more little ones come in with having anxiety about leaving their parents or going to school, separating at school. So definitely seeing an increase with that. And many of the times it's anxiety on both ends, like I'm talking about that one family. And so sometimes parents have a little anxiety around, I mean, parents usually have anxiety around that, but I think post-pandemic, we're seeing a little more heightened anxiety. Stress, not like we talked about all the different stress levels and stress spillover, rigidity. And so with rigidity, what we're seeing now is rigidity with some rules, right? And so this can become a problem with kids. You don't want things to be chaotic, but you don't want to be super rigid. And so when it came to like wearing face masks or illness rules, like we were very rigid with it. Grocery stores, right? You had to walk up a certain aisle. You could only come in at certain times. So we went from being very rigid and starting to loosen up a little bit, but things are still remaining a little rigid. And so for kids, that can be really difficult. And for kids who have lost control over situations, they naturally want to take control in those situations. So we see some behaviors arise around that. And so we talk about ways of giving kids some control. Rules around hand washing. And I know we did a lot of that. I actually worked with a toddler couple or toddler twins, not couple, toddler twins. We worked on hand washing when it came to them going back to school. And this was really important for their parents. And they became very rigid around that. So we talked about ways to kind of loosen that up, especially when the kids are at home. But to make sure that practice is occurring. And so kind of ways around that and ways to kind of shift that power and control in other areas. And it really helped them. Of course, they were still defiant about the hand washing at times, but they started hand washing most of the time. And so they were happy with that. And then the fear of illness is still there for a lot. I'm seeing this more with my preteens and teens who are having heightened anxiety with like fear of illnesses and vaccination hesitations. So what are we going to do? And so a lot of the literature really supports building back communities as a whole. So we need to really build back all of these supports that we have, not only with individuals, but communities as a whole. And so really respecting one another, going back to building back one another, because we've isolated and we have really distanced from one another. And so really working together to build back one another, adapting our services so that we can meet the needs of our patients. And that was the nice piece about the pandemic, is that it has opened up a little more telehealth so that we can reach more of a capacity. And so that is a nice piece. Provider support is another real big one. We've always talked about wellness, but now there's support towards wellness, there's funding towards wellness, there's encouragement towards wellness, there's committees towards wellness. So we're really making more of a movement towards wellness for providers, especially healthcare providers and mental health providers, because the needs are going up. And for healthcare providers, like that was exhausting and traumatic within itself. And so we really found a way to kind of support other providers even during the pandemic and after. So provider support as well, I think, has been highlighted, and family support. So again, like I'm saying, not only the individual, but the entire family. When we're looking at rebuilding, we want to rebuild that support for families, helping families find and identify those natural supports if they were not able to in this pandemic, but now find some of those natural supports for themselves. educate on navigating behaviors, and not only behavior problems, but social emotional development, so that you know where your kid needs to be. And if they're not, how we get them there. So that social emotional education is huge. And sometimes that's not something we always educate on. In early childhood, it's something we talk about on a daily, but I think throughout it could be really helpful. Teaching parents how to manage their stress, right? We don't want that stress spillover. We want more of a crossover, so an adaptation to what's going on around them. So really kind of managing some of that stress. And really the pandemic highlighted a whole lot of disparities where we were missing on supporting all individuals, right? So equitable care and making sure that everybody is receiving the same type of care is really important. So from all of everything I had read and all of the literature I went over in reviewing the past pandemic in the past 2 years, these are the recommendations that were highlighted. Flexibility, so being more flexible, helping understand. I know this is one that can be difficult in healthcare and mental health, but I try to be more flexible with my families, especially because I know that many of them are struggling with mental health. And for those of you who've had toddlers or have toddlers, you understand how difficult it is to get it together and get out of the house. And post-pandemic, it's even more difficult because you're used to being in the house. And so just being a little more flexible with individuals and sometimes if they miss or have to miss or what they're dealing with and where those struggles are. Learning to help others reduce their worries and kind of evaluate that and reduce some of those stressors. Prioritizing behavioral health and mental health and providing more of a prevention for young children before intervention, right? So like I said, I've seen an increase in 1 and 2 year olds, and we're doing a study now, so it could be a coincidence that now that I'm doing a study with it, I'm soliciting 1 and 2 year olds. But I see a lot more families that are wanting to be preventative. And so children that aren't displaying a whole lot, but parents are like, whoa, like what's going on here? And so they're wanting to be more preventative, which I think is definitely the way to go when you're looking at a child that was early on in the pandemic. Maintain a clear understanding of resources and how they're delivered. West Virginia has tons of resources. And so a couple of the different committees that I'm working on, and one of the projects that we were working on is really trying to get it. I mean, we all know 211 that kind of gives us all of those resources, but kind of a way where we can collaborate and help people navigate these resources more, because even as providers, half of the time I don't know what resources are out there. And that's why I love pieces like this, because you get to come across different people and kind of share some of those resources. And I mean, that might be an idea for us next week, is to just kind of share what each other does and resources. I don't know, but there's so many different resources out there, and it's so helpful to kind of explore some of that. Use and receive education on technology. I cannot tell you how many technology plans I did over the pandemic of appropriate screen time and how to manage that. And we did a presentation here, and I utilized all of those within some of the services provided and helping parents kind of navigate that. Because when you're transitioning, right, if you have a parent that's got like their job is transitioned to completely virtual and they don't have the space and they don't know what to do with their kids and they're trying to manage school and everything else, like the last thing they're thinking about is how much screen time their kid's getting. And so then once that kind of stabilized a little bit, then that's when the second wave came over, and they're seeing behaviors because their kid's now addicted to the screen and they don't know how to manage it, right? So that's where we saw these tidal wave after tidal wave after tidal wave just come through. Promote team-based wellness. So in teams taking care of one another, checking in on one another. I feel like we're getting back to that now better here, where I think everyone kind of got away from it because we were all so separate. I still feel super separate from people. So I'm always like really excited. I don't know, maybe that's a good thing, because I get really excited when I see people I haven't seen in the hallway. And I'm like, hey, for like a long time. People probably think I'm weird because then I stand there for a long time and just smile. Connect and outreach to vulnerable families. So families that you know might not reach out, but might be struggling, families you hear about, just kind of motivating them towards something. But just touching base, sometimes that compassion of just touching base and just reaching out, you never know the difference you can have on somebody, right? And so in addressing mental health disparities, just making sure that we're providing some of that equitable care. That's it. I'm going to open it up to any questions, thoughts.
I first just want to say thank you so much, Amanda. You always do a great job and feel like you're just talking to me.
Oh, you're so
really,
sweet.
really great. And the resources idea is a good idea too. If others want to reflect on that and email us, I think that'd be a really good topic. And yeah, I see a raised hand. Thank you so much, Abby. Go ahead.
I wasn't sure if y'all do that here, so I figured I'd do it just in case. Yeah, Amanda, definitely echoing what Elizabeth said. Your tone, 100%, just so clear, but also very personable. So I really appreciated that aspect. I wanted to ask you, and just anyone else who may have child expertise, because I don't work with kids at all. The youngest patient I have is 17 and they're in college, so they're not really in that kiddo stage anymore. But are we seeing more after the pandemic? Are we seeing more very young autism diagnosis? And do you think, and if we are, do you think any of that has anything to do with kind of developmental delays maybe caused by pandemic stress, etc.?
I'm gonna look at Dr. Swagger. Do you see any more an increase in autism delay? Or
you're gonna get a super crazy long answer that I'll try to make short.
I love it. Lauren, hit me.
So it's complicated. I think my answer would be to you that it is very common to see social delays and attachment delays, especially in kids with any type of trauma. So in West Virginia, because of our substance use challenges in the opiate epidemic, we already had seen substantial concerns regarding increased diagnosis of autism, or concerns regarding autism that often overlapped with complex trauma and attachment issues, because the symptoms can look very different. So while I cannot say to you that I have seen that specifically from COVID, I do think that there have been children with developmental delays that were reports of some delays, especially in speech and language acquisition and access to services that may have been delayed. But I don't know that that's been permanent. We've certainly seen recovery in children with that. But I think on top of that trauma, we were a state with very, very high levels of ACEs anyway, and certainly for a long time have had a lot of kids that look like they have some component of social delays or autism-like behavior, but it's always 10 more layers deep, if that makes sense. So I hope that was short, but I think that's just I think that's always a risk, and I think that's the challenge, and the intervention and ability to deliver the intervention, what the outcome will be, and whether you can really have them gain success, and whether it's recoverable and how quickly is really going to be key.
Yeah, absolutely. No, we're seeing a lot, like with our population here, we're seeing a lot of we call it TikTok diagnosing. So basically they see someone in their age group or maybe a little bit younger, say, oh, I have all of these symptoms going on. And I took it to my family practitioner who said, I have, 12 million diagnoses, right? And so we'll have patients come in that are like, I have DID. And we're like, no, but thanks, stuff like that, just kind of out of the box, things that they've never had, before, or any concern from any type of doctor before. So I was just curious how that's affecting our little ones. So thank you so much for your answer.
Brittany, I saw that you had your hand raised. Thank you so much. Go ahead when you're ready.
Hi, I went into this training concerned because my son was born in August of 2020. So full on pandemic baby. I speak with my coworkers at the CED a lot about him, and he's amazing. He's so spirited and wild. But with the pandemic, there's been thought of possible delays with him because of the very minimal social interaction in general, outside of his very small like care circle, I am getting him involved in daycare here in Morgantown soon. So I'm going to see like what effect that has. But so far he's 2.5 now. I have him in speech therapy services to try to supplement, where he wasn't able to even be around some of his cousins his age. But this training was super reassuring and insightful. So thank you for hosting this. And thank you, Amanda.
Oh, I'm so glad. It's very scary, right? And it's with everything else that was going on during the pandemic, like that can be very scary. And so absolutely. And I think, one of the biggest things that I probably work with parents on is just meeting their kids where they're at developmentally. And so us figuring out where they are social emotionally and meeting them where they're at. And even if they're treating their 3-year-old like a 1-year-old, to still treat their 3-year-old like a 1-year-old. So really that's a lot of my battle.
Thank you so much. And thank you guys. Keep the questions coming. We love it. Heather, go ahead.
Great presentation. I love this age group. And so I've been really curious about what everybody's seeing out there. Abby, just to kind of piggyback on your question, we do have a lot of younger kids, 5, 6, 7, that come into our program at the CED. And the one thing that I've noticed in compared to the last few years, there's such an uptick in oppositional defiant disorder diagnosed in young kids. Like, I am used to seeing that diagnosis usually like around 10, 11 years of age. And there's little ones 6, 7 years old coming in with this diagnosis, which seems kind of hard for me to swallow, because I feel like, well, all 6 and 7-year-olds are oppositional, and like they're coming into their own and they're wanting to be independent, especially after starting school. And so I didn't know if there was any insight onto that with anybody here on this call, if you're seeing the same thing. I'm just really curious, the social implications of the pandemic and how that's affected, their listening skills, their ability to be back in the classroom, their ability to conform and be back in the community and just kind of, pay attention and listen. Are we overdiagnosing? Are we, is this something that's happening? Because it's like, I keep reading all these things and I'm just blown away at the amount of young kids with this diagnosis.
Lauren's done. I'll let Lauren answer, but I will say, so this goes back to even Lauren's, whole thing with, I think we were doing it before that too, but go for it, Lauren.
No, I think that goes back to, as a child analysis psychiatrist, I'm gonna tell you my number one thing is removing the diagnosis of ODD, because I think it's like just an easy thing to say without digging deeper. And so I think it goes back to TikTok and having information. And I don't look at it as a bad thing, but I think it reflects like such a scarcity of true pediatric mental health providers that really know how to dig in. And I think you're seeing kids, and you are seeing increases in serious behaviors happening at school and home. Again, I think there's a huge trauma and attachment piece likely driving that. Undiagnosed ADHD. I mean, I hear ODD and I'm like, okay, let's find out what's really going on and let's dig a little deeper. To me, it's almost like too easy of a diagnosis. And I don't mean to belittle it, because it's a real diagnosis and it has substantial treatment needs, but it's rarely a solo cause, I think, of most true behaviors. But I think it reflects what you said about TikTok and Google, is that people, when they type in my child doesn't listen, and they see that. And I think it reflects kind of where we are with mental health, where people are interested, they are acknowledging the need for mental health, and they want to get connected for services, and they're looking for a diagnosis. And I think it's really up to us as providers to rise to the challenge and really provide that education, go deeper with really good assessments. But you're spot on. I mean, that diagnosis is kind of one that always drives me crazy, because it's in the eye of the beholder and not really a true assessment. So I always sort of consider that a challenge, but I also really look to that as someone is struggling with their kid and needs help, and it's your foot in the door. But usually the intervention is not that. And I would say, once you think there's another reason, it's really important people have that diagnosis removed, because that is not something that needs to be following kids around if that's not truly the cause. So
Yeah,
I
it's
don't know,
very rare
it's a
that
good
I
and a
get,
bad thing, I guess, but
Yeah.
I agree with you completely.
it's very rare that I get a kid 5 and under that I evaluate that's been diagnosed with ODD that stick with that diagnosis, because it's a symptom of something that's going on with them or their environment at that time. And so it's defiance is huge in every kid. And there's a reason why they utilize it, and they utilize it to manipulate their environment. And it's either to get their needs met or to fight against some sort of power and control. And so that's what we're really looking at, and what capacity are they doing that? And so it's usually to get their needs met. And sometimes it's not a bad thing, it's how they're surviving. So we just figure out how to shift some of that and work towards it. But I agree with Dr. Swagger. A lot of the times when I get parents so fixated on diagnosis, we talk about that because really we're treating the symptoms. And so sometimes it's not such a fixation on the diagnosis.
Thank you so much, and well said. Thank you, guys. And Abby, go ahead.
I just wanted to get y'all's take too on so I know I'm part of the generation that when we were in elementary school and middle school, basically every kid that like could not sit still. Now, whatever child that is, younger than high school age, they can sit still for an 8-hour period, except for recess. I don't know any child like that, first of all. But second of all, like every single kid that could not sit still or that had like any type of redirection kind of concern would just kind of get slapped with a ADHD diagnosis. Are you guys still seeing like just blanket statement diagnoses like that? Or are you seeing more of an uptick in that approach that Lauren was saying was like take off the diagnosis and look at the underlying, root causes of things?
I feel like sometimes with ADHD, we're starting to actually really look at some of the root causes. I think there's been a lot of studies, like Lauren had hit on earlier. There's a lot of studies. I mean, PTSD, we're in a very significant area where there's tons of high ACE scores and complex trauma. And complex trauma, there's a lot of ADHD symptoms that overlap with PTSD symptoms, right? And so and we see a lot of that. And for kids who have any type of developmental delay, there's a natural hyperactivity within that. And so I think it's really looking at that and looking at this. I mean, I get a lot of kids referred to me for ADHD, but once we implement some of the techniques and I clearly don't see any ADHD in my setting, then we know that it's a controlled behavior, right? And so we kind of address that, but I don't know if you see anything different with that, Lauren.
Well, yeah, sorry, more information than you probably want. I think it's even more complex than that. When you look at true patterns of ADHD diagnosing, there's certain populations where it's being overdiagnosed, but there are substantial pockets where people are misdiagnosed or not diagnosed soon enough and are delayed in their treatment or get labeled with things that could have been treated with ADHD. So when you look at diagnostic patterns, there's actually quite a mixed bag depending on what population you're looking at, their access to service. And so looking at diagnostic data is quite complicated, and there is high rates of comorbidity that can occur from both. But I'm going to throw out another very West Virginia specific example. And those of you who've heard me do this before, I apologize. I can't stop myself. But, we live in a state where 28% of women smoke when they're pregnant. There are enormous rates of in utero exposure. And we know that all substances of abuse attack the frontal lobe and cause executive functioning patterns that look and mimic ADHD, but are probably not similar to biologically inherited ADHD at the genetic level. And so to talk about the diagnosis of ADHD without a difference in understanding the etiology of the ADHD, if it's from an exposure or a biologically receptor mediated process, is really quite challenging because we certainly have reason. And when we look at West Virginia, we do have higher rates of ADHD diagnosis, but very hard to know if that's truly genetic or related to significant socioeconomic poverty, ACEs, all the other comorbidities that cause it. So it's a hot mess, but I think it's important to pull that out, because I think much like ODD, it's ADHD is also one of those things. Everything can look like ADHD if you don't really dial down and see what it is. Kids are hyper, and you gotta dig in and look for other reasons and prove it, as opposed to just slap it on there and not look for other things. So I don't know. Sorry, that was long-winded, but I
No, thank you both. I
lots
really,
of
really
challenges.
appreciate it.
No, thank you so very much, as always. I know we're over time, but it's been a great discussion. Does anybody have any final questions or comments? Or if you do in the future, please email us. So that only announcement then is the next session's going to take place on the 15th. We'll be coming back from a